But first, as the war in Sudan enters its third month, the country's health system is on its knees. Already struggling before the conflict broke out, dozens of clinics have closed their doors and patients are going without life-saving medicine. Dialysis patients are dying, unable to get the treatment they need, and bodies are starting to rot as they pile up in the country's overrun morgues. Multiple ceasefires have done nothing to blunt the conflict, with US and Saudi-led mediation efforts flatlining. Patrick Youssef is the Africa Director for the International Committee of the Red Cross.
Hospitals that we are able to talk to are telling us there are complete outages of electricity, no food even for the staff and for the patients. So again, according to the Ministry of Health and the WHO, talking about only 20% of hospital capacities left in the capital, Khartoum, and we've heard very, very sad stories about patients dying just because they're unable to receive the required medical care. Sometimes because there's lack of personnel, doctors are just unable to go and be next to the patients they're supposed to treat, or indeed the lack of material. There is also a possibility that healthcare may collapse in Sudan at any moment, despite all the best efforts of Sudanese doctors and nurses who are really heroic, who have done all their best and continued working in extremely difficult conditions. Health facilities and health centers have truly to be protected. Here we're talking about a life or death situation. This is an imperative that both parties have truly to abide by the laws of international humanitarian laws and principles to protect these critical infrastructure and provide them the space to be well equipped and indeed resourced enough to treat and care for the civilian population.